The most common reason to have low back pain is a disc issue, about 40% of the cases. And when you lean forward, you're stressing that disc right there. Relax, relax. That was good. There you go. Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, where we've got medical services, chiropractic, exercise, acupuncture, massage, all kinds of stuff all in one spot. And today, we're going to pretend that Joss here has a bad low back disc problem. And we're going to walk you through some of the things that we do for it here at Creekstone, okay? So, Joss, let's have you stand up here, facing that direction, bend forward. And that is usually going to hurt a whole bunch for a disc injury, okay? Stand up and I'll explain. The most common reason to have low back pain is a disc issue, about 40% of the cases. And when you lean forward, you're stressing that disc right there, okay? So for a disc injury, that's gonna be problematic. Sometimes as you bend forward, it's gonna run pain down into that leg, okay? So, alternatively, let's have you face that way and we're going to go backwards. Usually that can still hurt a disc person, but instead of spreading into the legs, it's going to bring it into one spot typically, okay? So that's called, when you bend forward and it spreads, that's called peripheralization. When you bend backwards and it comes into one spot, that's called centralization. It can get a lot more difficult than that, but for this video, we're gonna keep it real simple right there. Okay, have a seat. So since it's under 60 years old, since the disc is the most prevalent reason to have issues, then we're already pretty sure we got a disc going on here, but we're gonna confirm that through a few tests, okay? So let's do the slump test. Slump forward like this, chin on your chest. She's hypermobile, so she slumps really forward. Okay, so anything like this is really gonna aggravate a disc issue. Sometimes just bending forward is gonna do it, but when you pull those legs, you're pulling on nerve roots in the low back, and that'll get their attention. Okay, sit up. So, typical hot discs, it hurts to go from seated to standing. Walking usually helps. It hurts to cough or sneeze typically. Sitting is the least comfortable. Lying down is the most comfortable because you take weight off of the disc when you lay down. When you're sitting, that's the most pressure you can put on a disc, so it's the least comfortable. Let's see. Let's have we test the reflexes, right? We're gonna do that real quick. She doesn't have any, because I don't know why, but we're doing it fast, so it doesn't matter. Your reflexes are evenly bad, and then we scratch and we test sensory information in different areas. That should be even side to side. Stop. Raise your knee up here. Now resist. I'm going to push down. Do this one. So we test all of the muscles. I'm going to push, resist. Push, resist. I'm going to pull, you hold in. All right, feet up. I'm gonna pull down, you hold up. Now down. I'm gonna try to, there we go. Okay, so everything's even, no bowel or bladder dysfunction. You always have to ask that because that's an emergency room surgical visit if we've got that going on. Okay, let's get you on your back. You got this. Okay. All right, so we're gonna do straight leg raiser. That's what we're doing is we're pulling on nerve roots when we do that. Ouch, 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 that hurts. We back it off about 10 degrees and do what's called braggarts. We're really pulling on those nerve roots, and that's problematic for disc people a lot. Raise both feet about 6 inches at the same time. Okay, for disc people though, that's a no-go. That ain't happening. Okay, so let's set you up, and let's go get some movement going here, and then we'll walk through some more of this. So normally we would do this in the exam room, but what we do when we've got a really hot disc in the low back, especially when you've got peripheralization when you bend forward, you've got centralization when you bend backwards, we're going to test that even further by having the patient lay on their stomach but up on their elbows if it's comfortable. If it's not comfortable, they can do it with their fist under their chin and lower it down like that. But most of them can get up on their elbows like this. It's not a plank. We want their low back to sink into the table, nice and comfortable. And then we hold it for 3 minutes. If it helps, so after 3 minutes, we get up, they walk up and down the hallway. If that is helpful, then we know that they are probably extension bias, and extension bias exercises are in order for this disc patient, okay? All right, so we're going to pretend that that helped you, okay?
Oh
You
my
feel better?
gosh.
Yeah,
Wow.
yay, what a savior. Okay, now let's get you adjusted. Let's scoot up just a little bit. Now, low back discs don't like a lot of rotation, so we're going to go easy with her, but she's hypermobile. So it may not look like I'm going easy with her. She's popping a lot. I don't know if you can hear that. On your side, facing me.
I can.
Yeah. Sounds like it feels good. Come my way. Relax, relax. That was good. Other side. Do you like that one?
Yeah.
No, bend the top, straighten the bottom.
Oh, whoops.
Let's act like we've done this before. There you go. All right. So now we're going to go do some extension bias exercises.
Okay, so I'm going to show you guys some exercises. So this is our first one. We're just going to get on our elbows like we did it before and kind of in a plank position, and we're going to sit here for 1 minute and just hold it. So. Okay, so our next exercise is going to be very similar to the one that we just did. So we're going to get in the same sort of position with our body down, but we're going to keep our arms straight, almost kind of like in a cobra position. And we're going to hold this for a minute. Okay, in our next exercise, you're gonna put your hands behind your back right here, and you're gonna lean back, and we're gonna do that 5 times for 5 seconds. So we're gonna lean back, 1, 2, 3, 4, 5, come back up, lean back, 1, 2, 3, 4, 5, come back, go again, 1, 2, 3, 4, 5, go up, go back down, 1, 2, 3, 4, 5, come up, one more time, 1, 2, 3, 4, 5.
All right, so now we've done all of the exercises, we've done an adjustment. We know that this is a hot disc patient, and one of the best things you can do for a hot disc is get the inflammation down if you can. And one of the best ways to do that, not just according to me, but according to the world's largest medical organization, the American College of Physicians, is low-level laser. It's a first-line recommendation. We've got one of the most powerful ones that you can find here. It's the M6 cutting-edge laser. It's a little robotic laser, as you can see it doing its thing here. And so we're going to do cold laser, and then we're going to double that up by putting her on decompression and try to take the pressure off of that machine. So let's get started with the cold laser. There we go. Now it's doing its magic. So this will go for about 10 minutes. Joss will get a great little nap, and then we'll do decompression, okay? Okay, so what we're trying to do here with decompression, we got it in good and tight here, is we're trying to create a little bit of a pumping action with the vertebra. And what we do is we pull her at 1/3 of her weight. And so it's gonna separate, it's gonna pull for a certain amount of time at a very certain amount of weight, and then it's gonna release. We still have pull on it, but release a little bit with a certain amount of pull and a certain amount of weight. And then it just repeats the cycle, getting a little pumping action in there, trying to rehydrate the disc, trying to reduce any kind of herniation or disc issue. So that's what we're doing here. It's usually about 10 minutes. We do it 3 times a week for a certain amount of time. And as she's able to, we'll increase in weight as we go, maybe up to 1/2 of her body weight if possible. So that's kind of the whole thing there. We do the exam, we figure out what's going on, we figure out what are the best exercises for her particular disc issue. Then we get her adjusted, we get her going with the right exercises, we get the cold laser to get the inflammation down, and then we get decompression going to try to create space, rehydrate the disc, and reduce inflammation. And our disc patients usually respond very, very quickly. So if we can help you, make sure you call 806-355-3000, hit the subscribe button, and we'll see you in the clinic.